This afternoon, the president of the striking Ghana Association of Medical Laboratory Scientists say they will suspend their strike later today after an ongoing meeting. The leadership of the association, together with the Ghana Medical Association, the head of Healthcare Facilities Regulatory Agency and the National Labour Commission, are currently in a meeting with the Parliament Health Select Committee to resolve the almost 2-week-old strike, which was triggered at the Komfo-Anokye Teaching Hospital. Let's take you to Parliament, where the meeting is ongoing right now.
Maintained until he took other administrative duties at the Allied Professions Council as registered. That was Prof. Opoko Okra. The current head of the hematology lab was appointed in acting position from 1st August 2015 to date. He has applied for the position of headship, attended interviews, and even in those cases, he was the only one who went for those interviews, but has been denied opportunity solely because the aspirations of the Ghana College of Physicians in getting a laboratory physician to manage the laboratory was not attained. The board of the hospital to date have not confirmed his headship on full-time basis, owing to the fact that he is not medically qualified. And interesting enough, at the interview, which was basically made up of people of the college and other administrators, he was asked if he's ready to work with members of the college. And he said the law as it stands does not permit it. And he was denied on that basis. That was the only question he was asked. This cannot be coincidence. Then on, hospital management employed the service of 2 medical officers and assigned them to the laboratory section of the transfusion medicine unit in 2018. These medical officers virtually did nothing at the lab other than observe laboratory processes under the guise of being trained at the primary level by the Faculty of Laboratory Medicine at the college. Heated confrontations led to the reassignment of the medical officers to the Internal Medicine Directorate of the hospital by Medical Director on 26th of November 2018. Appendix is also, the letter reassigning them is also available to us for the attention of the chairman and the committee. The letter reassigning the medical doctors indicated that they were to run hematology clinic, sickle cell clinic, and perform bone marrow aspirates at oncology, at the oncology unit. From their new position of operation at the Director of Internal Medicine, the medical doctors collaborated with the lab in reading hematological slides and interacting on issues of mutual concern with no ensuing issues because their operations were not direct conflict with the role and mandate of laboratory professionals. On the 22nd of February 2019, the medical doctors were reassigned from internal medicine to the hematology unit of the lab again, laboratory services. The letter is also here for the attention of the committee, and the appendix attached, with clear explanation that their duties were to be assigned assigned by the head of laboratory services directorate, which includes but not limited to running of hematology tests. This is, I'm quoting from the letter. They were to run hematology tests. Testing by the law is the activity as provided in Act 857. On the 2nd of July 2020, 2 new medical officers were assigned to the hematology unit for permanent duties by the medical director. Appendix, the letter also attached, but their duties were not specified. The presence of these medical doctors at the lab unit feeds into a grand agenda of the Ghana College of Physicians to subvert the professional role and mandate of existing professionals by causing medical doctors to practice on the bench without recourse to delineated roles and proper regulatory procedures. The scheme to redesign the organogram at the lab unit to recognize medical doctors as leads of the heads of the hematology lab is clearly detailed in a proposal by the Ghana College of Physicians to the minister during stakeholder consultations. The appendix is also attached. Their proposal for that is also attached. The event stipulates, the caveat stipulates that if laboratory accepts those medical officers as staff of the laboratory. Then the CEO can appoint them into headship position of the lab, with others being duly recognized as senior specialists who will supervise activities in the laboratory when they have no training and scope of practice in the operations of laboratory profession. So we see clearly a clear agenda to impose, despite all the resistance. So if we're talking about people who have come under oppression, it is we, not the claims that are being made by others publicly that they were threatened. I can tell you, members of our profession were physically threatened by directors of institutions, that they were coming down to hound them. And these are things we think by the end of this meeting we should be able to solve. The unethical posturing and professional disrespect to the med lab profession. The enumerations thus far points to gross professional disrespect and ethical posturing to the medical laboratory science profession by the Ghana Colleges and Ghana Medical Association. The posturing of these two professionally recognizable bodies seem to suggest that collaboration can only exist if physicians act as heads of laboratory. They have in perpetual earnest thrived on the underdevelopment of the laboratory profession in Ghana to justify the presumption that medical doctors and by extension physicians are the bona fide professionals who can lead and manage laboratories in the country. The posturing and justification by physicians to lead laboratories in the country has been based on the fallacy that there is no peer-reviewed college training specialist medical laboratory scientists. Physicians have been in the helm of affairs at the Ministry of Health and day-to-day management of the health sector over the years and perpetually stifle the development of the profession, with notable acts being the vehement opposition of implementation of the National Laboratory Policy developed in 2010 to address gaps within the medical laboratory sector. Interesting enough, when CDC and other global institutions saw the state of laboratory practice in Ghana or service in Ghana as disorganized and under-resourced, together stakeholders were brought on board to develop a policy. It went through stakeholder reviews, and members of the College of Physicians and Surgeons who were part of these processes and whose views were voted out at stakeholder levels went behind the scene, and we have minutes of and attendances of where they attended these meetings, went behind the curtain of their connections at the ministry to raise claims that the college was not invited. But I'm aware at some of those meetings, Professor Eken was there. We had Dr. Bruce Togo, Prof. Bruce Togo and co were all present at this meeting. Dr. Kitley of the same lab now was also present. Their views were voted out by the stakeholders, and they came behind to write in the name of the college. I can tell you along the line, the first attempts were boycotted by members of this college. And when the process went through, the minister signed this document. He was advised by his technical director, his technical advisor, the Ghana Health Service Director General, who also signed the documents. A day was set for launching, and a letter came withdrawing the launch. It was such a dark day for us. I'm wondering if people who are committed to the development of the lab in this country will be ready to shoot it down and ensure that we are still in the state in which we are. When COVID came, we were faced with confusion because the structures could not hold, and we had to depend on the research centers to support us. These were the things we anticipated as a professional group when we championed and advocated for such a policy to be in place for us. I think if they are not interested in the policy, they don't care whether it comes to be or not. They are not bothered about it. But we are bothered. We have only one wife, like Uriah. They may have many wives, but we have only one, and we protect that wife. Fellow professionals from Ghana College of Physicians and GMA have always sought to dedicate.
Doc, my council, my committee says that you are good Christians. Thank you.
Right. So we are committed to seeing the welfare of the laboratory and collaborate with everybody. Because we have no other specialty to go to. We don't have gynecology to go to. We don't have radiology to go to. We have only laboratory. So we want to see the growth of the laboratory, and we'll do nothing to denigrate the lab. And let me mention a few things which would surprise all of us. Professionals from the college, Ghana and GMA faculty have always sought to denigrate and subjugate the male lab scientists, as evidenced by their recommendations to the Prof. Ayite Committee, as per the following code. The Ministry of Health should have an organogram to give clear direction in the management of labs. Laboratory reports should end with laboratory physician and should be signed by both lab physician and the lab technologists. But it should end at the laboratory physician. So if a lab physician does not sign the work I do, it doesn't go out. Well, we are talking of professionals who are less than 25 in this country, in all. Supervising over 5,000 to 6,000 professionals. This is not possible. The laws, and this is what the federal said, the laws of medical and dental practice should be amended to reflect the role of physicians. As we talk, the definition of what has to do with testing or investigation related to the management of disease in part 1 of the Act 85, that's under medical laboratory science. The definition of medicine as we have in the current Act certainly does not even mention laboratory medicine. So it is alien to even the law, the Act 857. And therefore, to say that you are now going to move to tamper with the law to make you now relevant means that you admit that you don't have the power to practice. And we are aware that attempts have been made over the years to have these changes done. And we picked information about this. Proposals were sent to the ministry, and we got wind of it. And we are aware that this is the agenda, to now change the law to make testing part of their regular work. And that is going to spell further confusion. And they also said the policy should be amended because lab technicians cannot interpret some reports. Let me state, if you look at our current job description and scheme of service, provision has been made, and there are documents here, which includes the interpretation and the advisory services from the medical laboratory scientists, all there in the particular law. And we are not defined by what another profession tells us. We are defined by the law. And the law has told us, this is your job description, this is what you do. Why would somebody who now want to come and limit us? And these are the issues that are bringing the resistance, which we have seen as a pattern. Headship of laboratories at the various levels should be open to only laboratory physicians. This is another recommendation from the same group to the Ayite Committee. So if today you are saying that, oh, we are not interested in headship, then what are you interested in? When it is expressly stated, your intentions, calculated intentions, have been what? Decoded. Lab physicians cannot be regulated by allied professions, which means that they treat our council as not having the capacity to regulate them. And it is that downplays the relevance of our council. And this thing has hurt a lot of people over the ages, over the years. So you can see what is building up as and leading to an issue of an explosion, what we are seeing on the ground. Ghana refugee surgeons should have oversight responsibility at the various levels of laboratories in the country, as labs are used for training purposes. That is, we do not doubt that labs are good for training purposes. But to say that you should have oversight responsibilities just because they are, it's not the basis for that. We train pharmacists who come around our labs, teach them how to hold pipette, and say, this is a sample, this is a machine, this is cotton wool. But that doesn't mean. And doctors go around pharmacies, and they learn medicines. They learn all this, but it doesn't make them heads of the pharmacies. Or you go through nursing practice, as we see our colleagues go through, but they don't suddenly become heads of the nursing practice or pharmacy practice. And I think this idea by the college should be relooked at. I think there's a need for a change, a paradigm change in their approach. We are in modern times and we need to wake up. Lab physicians cannot be regulated by the other professions since they are already regulated by the medical industry. That is fine. So we are in effect asking for a number of interventions that steps should be taken to ensure that we have a clear line of progression. And why do we say this? Well, our current line of progression is being thwarted. Currently, we have PhD holders, master's holders, degree holders in abundance. Recently we went to Nigeria, we came with 85 foundation fellows of our college. And this college has been approved by the same WAHO that approved their West African college. And we've put across even petitions to the ministry for even a national college for medical laboratories for specialization into consultancy grades. So as we talk, we have over 85 specialists in the country, already more than specializations from the college in this area. And we want us to curtail all this just because we want our work to be supervised by physicians. I think I'm putting this across because I want us to feel what led to all the explosion that we are seeing, because we've been under pressure for a long time. We think that we are skilled enough, we can lead ourselves, we are of age, and we should be allowed to be on our own. One of our guys said, but marriage is not by force. If you want to marry us, you should talk to us with respect. That's the way you woo a lady into marriage. Not, you don't castigate the lady, you harm the lady, but you want the lady to be with you, and when you come, he should smile. This is part of the issue that happened. The notion that lab professionals sacked doctors from the lab is not the fact. When they came around for training, we said, you insult us in public, you castigate our results, you send it to private sector, you cut down IGF, we want a policy, you shoot it down. We want to progress. For a long time, we're capped as certificate and diploma holders. Until 2000, when training in degree started, by the same members from the college. And you want to come and say, let's teach you to hold a pipette. The person does not have the heart to do that. So when you come, we fold our arms. It was interpreted as sacking them from the lab. But the lab is a place where people can come for training, for research, and all that. So we think that clearly the issue of breaking our professional rank, this in progression should be. And we also think that just like we have pharmacists who have specialized in pharmacy and they are pharmacists, you cannot specialize as a doctor in pharmacology and you become a pharmacist. So we should be allowed to be on our own, and they should be allowed to grow along. Then the regulation in terms of Act 857 was also given to us. But I can tell you, as far back as the 80s, the lab had a proposal for the same regulation for the lab sector. These documents got missing along the way, many, many times, until we were put with another group. And they say, because we were not privileged to be in the ministry, if people had the lab at heart, they would have sought for the regulation of the lab many years back, not thwarting. Not thwarting. Finally, we've gotten Allied Health Professions Council to be at least our mother again. That one too, you want to shoot the mother. We think that the scope of practice is clear, and there's no conflict between our practice and the practice of what? Medicine. They are medical officers, they are clinicians trained to treat conditions and not to do testing. So allow the testing bit for us to play our role. We also think that we are of age and we can take management decisions on our own. In fact, the quality management systems, especially the ISO 50189, which is one of the global standard for the product of med lab, provides that anybody who works in the lab must have a specific role. specific role. That's working, not just coming for training. That's not what I mean. But working as a full-time, because the place is a biohazardous area. So it is not a place to just enter and come out. So we should have a rule that we want these people to come and play. And I think we are open to areas of collaboration as a laboratory. We are peace-loving people, as laboratory people. We've endured this for years. So we have been patient, and we are ready to collaborate to train members from the college, all right? Because we need them to also train us. They also need us to train them. Then we also need each other in terms of patient care, discussing the patient conditions. When it comes to research, there's a need for collaboration, and we are open to all that. That should not be interpreted to mean that we should be dominated. We are proposing strongly that we should have a clear directorate where the lab professional and all allied health groupings report through their director, technically and administratively, to the chief executives and to the director general of the Ghana Health Service. So that, because already physicians are leaders in all these areas. But to come and micromanage us is a problem. And we also will respect that they also have an organogram where they are giving their best to train themselves to the highest. If you have a pathologist and you have a consultant lab scientist, who are both consultants, they can collaborate in research. And if, for instance, I need a bone marrow to be taken, which can only be done by a hematologist, a clinical hematologist, the lab person will approach, please, kindly take this specimen for me. And if he needs a service to be done, prepare a slide. I want to confirm that what I'm seeing in terms of my clinical service is the same as what I'm seeing in the book. We'll gladly do that easily, and we are open to that. But we would not accept a situation where you come to supervise our work and we report to you and not our kind to the chief executive. This is a simple thing we're asking. So in conclusion, we're asking, one, that the names of the people on the laboratory staff in the Kofanochi should be taken out, and we allow our laboratory staff to be alone. If there are areas of collaboration, let them set them up also in the pathology unit where they can collaborate. And when they need us, we can come there, prepare the slides for them if they need any stain for them, or if we need them to take, for instance, administer a drug when we are doing therapy, for instance, a suppression text, there's a message, we can call on the doctor to come and do that, but not to sit in the lab and validate our results. We are also asking that our colleague should be reinstated, confirmed as soon as possible by the management. They were also asking clearly that a clear structure be done for us with our scheme of service where we report in line with the mind of the ministry, which has set up an allied health unit at the ministry for us. The ministry has thought of this and has prepared that for us. In line with the parliament, which has set a law for allied health, also in that direction. In line with the same parliament which has set, for instance, a membership for us in the teaching hospital board to show that allied health is unique and they should report so they can have proper corporate governance and inclusivity. I want to thank us all for the audience, and I thank the President for the privilege to have shared this. Thank
you. You are in Parliament. We don't clap in Parliament. The best response is here, 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 here. That's fine. Thank you very much. Doc, very good exposition from you. Congratulations to your able body for this well-written presentation and submitted to our committee. We are most grateful for you attending to us, and also we have also listened to it. If there are any clarifications, I would leave it for members to do it quickly. And then, President, do you want to add something to it briefly?
Yes, I just wanted to say that we'll be glad if we were given opportunity to see some of them, because we've seen some documents that are flying around, which we know may end up on your table, that we need to act on or react to.
Which document is that?
We've seen some HIFRA letter to the medical and letter to the GMA saying certain things.
Is it tabled to our committee?
That is why we have not, we don't know what they have.
No, this is the act. This is the act. The Health
No, I'm not talking about now.
Act. Or the HEFRA Act 829. Is that what you're talking about?
No, what we want to say is that we know there are certain documents that may be presented to you, and we will be pleased if the committee...
Mr. President, calm down. This is a house of records, and we are not delving into issues now, because whatever you say, if we start asking you questions and it starts flowing you, then it comes to subjective positions on issues. So no suspicion. If there is any document available to committee, it has been submitted to the clerk's office, which means that it has been accepted by the House. And that is not going to be a private document, it's public. So for now, please, let's calm down. Let's calm down.
Thank you, Chairman.
So we have listened. Yeah, Ignatius, member.
We would want that to help the committee's work, and we heard that a petition has also been submitted by our colleagues from GMA. A petition has also been submitted by our colleagues on GMA and the college. We would want to officially request from the committee.
May I take this opportunity to update you with the bodies who have brought petitions to the committee? Clerk, please quickly run us through them.
We'll be
glad.
Yeah.
So we have GMA, right? Is it only GMA? We have Society of Medical Laboratory Managers. Is that all? West African Postgraduate College of Medical Laboratory Sciences. Is that all? And then the Ghana Association of Medical Laboratory Sciences. So these are the various bodies we have heard from. Okay.
Yeah, Mr. Chairman, I think we have not gotten to where you want us to get to. I think that if there's a need for us to show you documents that has been presented to this committee, we will do so. We have not gotten there at all. So today, you are supposed to present your case, and we'll listen to other bodies as well. So you calm down. If there's a need for us to show you any document, the same way, if they also want to see any document from you, we'll give them the opportunity to look at those documents. So we just calm down.
Yes, and then we also have some soft copies and emails that have been received, but we've not printed them. Among others, you have the Ghana Federation of Allied Health Professionals and what have you. We'll get to that stage. Now we have received and we've heard your submission. And then also would, like I said, if there's any clarification, we'll allow members to ask. Yes, please go ahead.
Yeah, Mr. Chairman, I hope that all the letters you have referred to are attached to the document presented to the committee. And in your submission, you kept mentioning the law, the law. In some cases, you don't make reference to the exact provision. I hope in the details of your document, the exact provisions have been referred to guide us in our deliberations. I hope these are done.
Any other clarification from members? All right. To add something to it. Okay, say something.
Thank you, Mr. Chairman, for the opportunity. Mine is not clarification per se, because this is not the time to ask questions. As the chairman rightly said, if we start a cross-examination now, we are shooting people's presentation. We are listening to all of you. But what I can say is that strikes are very important to get the attention of authorities to listen to us. So I think that by this strike action, you have achieved what you sought to get. Now, your petition is receiving the best attention that you can get. And so I'm adding my voice to the fact that let peace prevail, let's calm down, and let's trust the system. I know this is not the first time Parliament has done something for your association. It was Parliament that passed Act 857. Parliament is here again to make sure that all the parties get the best out of this discussion. So I'm adding my voice for you to actually call off the strike and trust that this system will get to the bottom of the matter and make sure that all the parties get the best. Thank you very much.
Okay, so before you respond, for those of you who have been here, this submission or this contribution is from the Honorable Lisbeth. Lisbeth, please go ahead.
So my name is Elizabeth Ofusojai, and I represent the good people of Techiman North. Thank you.
Okay, and she is an
a member of
NDC Member of Parliament. It shows you how diverse when it comes to health. Politics does not separate us. It's Ghana's interest on this issue. And you should see her submission. Now, the ranking member, Honorable Akando, is, I don't know which angle he's coming in from, but you go ahead.
Thank you, Mr. Chairman. Before we started the meeting, we were requesting you to do the needful, but you assured us, you only gave us assurance. We have listened to you. I think we've gotten to the point that you must call off the strike now. You have done an excellent presentation. You are going to take leave of us, or you listen to other presentations. But at this point, I think that you must call off the strike, or whatever word you want to use, whether suspension or call off.
So thank you, Ranking. So we can give you probably like 2 minutes if you want to step out to confirm, and then tell us our position. If you have confidence in us, if you want us to take this forward, like we said, we've heard you. We've heard you want reassignment of lab physicians who were posted to cut. You want current heads of hematology of Confanoche to be confirmed. He's been acting the capacity for about 6 years. You want a medical directorate, I beg your pardon, for medical laboratory scientists to be established, and that will see to training and your welfare. You want Confanoche to take steps to separate the Directorate of Pathology from you. And then you also want clear job descriptions from your employers for the pathologist as well. And so we've taken note of the very core proposition of yours. And you reiterated in your petition that you want the concept of testing in the laboratory to be taken off as an objective of training or as an objective of working in the laboratory. Many others are subsidiary to and probably subserve the interests of these main areas. Would you agree that with me on these are the most topical areas? You want clear line of progression. Would you agree with me?
Yes.
You have specialists, you have consultants, and there is no clarity. So at a point, you don't seem to know where you're going, in as much as you are fine and you are specialized, and there must be clarity. So, and many others. So we've taken note of all these things. So there's supposed to be much confidence in you that we understand the issues. As of now, we can't speak to it. Can you get yourself some 2 minutes? And then or if you are done, you can tell us your position. If you want the community to go ahead with this, or you don't want us to go ahead, so therefore you will not call off the strike. So if you want us to proceed further on these issues, you state your stance, and then you can, let's take away suspension. You can call it off on conditions that we are going to follow, and you see an outcome also so and so. But suspension is like you are also ambushing the People's Parliament. You can't ambush us. Thank you.
Honorable Chair, I must say that before we arrived here, we had an emergency National Executive Council meeting for which a decision was taken that if we come here and we get the best of attention, we would appeal to our members, the regional chairman, the chapter chairman, to please do very well and call on members to suspend the action as it is now.
So you want to give conditions to the People's Parliament.
Oh, no,
so suspension is what you are using. Suspension does not give any mandate to it. The Speaker will ask the people are suspended, so what is our basis in that? What confidence do you have in the people to go ahead to talk about this issue? I think you have the right to confer again and use the appropriate word, so it gives us that gravitas to even present to the leadership of this Parliament.
Honorable Chair, let me say that I have with me my honorable member, who is the DC for Akachinov. As we speak now, he's here to step over. He understands the politics of Parliament, so I want to give him the opportunity.
DC of Akachinov.
Honorable Chairman,
yes,
I want to apologize for the
position here is not about the local government.
Honorable
doing
Chairman,
politics here. Position is clear. Are you going to call off the strike to allow the committee to proceed, or you are not going to call off the strike and then maybe you guys go to the court and then you deal with it yourself?
Honorable Chairman, I want to assist the President. Before coming to this meeting, out of respect for this committee, the National Executive has already met and decided that we have to call off the strike. That is a point that has to be made. And I just want to assist the President, make it clear. He keeps using if, and he gives the impression he's giving conditions. No, the NEC had already met on this matter. But the strike was actually...
You have to give us a louder here. You heard him speak. Yes, you heard him. Or you are not happy about that. What they are saying is that the position is that after these deliberations, per what meeting they had, the strike is called off. Is that not the point?
That is it.
So that you give us the opportunity to work on this, so you have confidence in us. Okay, so please, before GMA will come in, press, you may want to redirect, this your cameras, you may want to redirect it to those who are going to call off the strike. They had a meeting with the National Council. Their position is out of respect to Parliament, the People's Parliament, and for us getting to them, they made their mind that when we allow them to speak, and as they're speaking, they will call off the strike. So it's not going to come from our mouth, it's going to come from them. So the press, we would give you some 1 minute or 2 minutes, and then you have an interaction with them, and then you'll be back to listen to the GMA. At this point in time, our sitting is suspended for only 5 minutes for you to do that. Thank you.
Visuals coming to you from Parliament, where the Select Committee on Health has been meeting with the striking members of the Association of the Ghana Association of Medical Laboratory Scientists there. As you heard the interaction, the lab scientists had the opportunity to present their case, a number of things they were looking for. Of course, this started at the Konfanochi Teaching Hospital. They're talking about the hematologist, 2 hematologists who have been posted to that department, who they believe are there to head a department which has been headed by a lab scientist in acting capacity for the past 6 years. They are asking that those 2 hematologists who have been posted there be withdrawn from that lab because they believe there is the potential they will be leading, and they do not want that. Apart from that, they've been calling for this action to be across the country, where all laboratories are headed by lab scientists and not medical doctors. They're also asking for the establishment of a directorate that will facilitate training and personal development of their people as well. Now, what has just happened is that they have laid down their requests, their expectations, if you like, their demands, and the Parliament and the Parliament Select Committee's chairperson, who is also as you saw there, flanked by the ranking member, Kobna Minta Akando, as well as the health minister, whom we haven't heard since the strike began, has also been there. So they say that they have heard them, they have heard their demands, and they are requesting of them. Initially, the chairman said they're requesting of them some 2 minutes, so that they're actually giving them the 2 minutes. And the request from the Parliament Select Committee is for these striking lab scientists to give them a chance to work on their concerns. Giving them a chance to work on their concerns means they want them to call off the strike. There has been a little bit of a banter between the sides as far as what has to be done is concerned. Does it have to be a call-off of the strike, or does it have to be a suspension? Initially, the lab scientists had indicated a suspension is what they had agreed with their NEC members prior to this meeting to do. But it looks like the demand on the side of the Select Committee on Health is for them to call off the strike. They believe that once they call off the strike, it gives them a bigger opportunity to work on the concerns that have been raised by the lab scientists who are on strike. Our parliamentary correspondent Joseph Opoku-Gakpo is standing by for us at this meeting, and we'll be crossing over to him so we can understand also what is happening there behind the scenes. As you've seen, the lab scientists also had a DCE come along, who I believe is a member of the association, who then indicated that they will call off the strike. Now we wait to see whether it is a suspension or the strike has been called off completely. We will get to know. It looks as if they have started speaking now. Let's take you back to Parliament right now.
Held at the Oceanic Resort Hotel, Accra, Tuesday, 1st June 2021. The National Executive Council of the Ghana Association of Medical Laboratory Scientists, having met on an emergency meeting held on Tuesday, 1st June 2021 at the Oceanic Hotel, Accra, have resolved as follows: that we have taken charge of the industrial action staged by the Konfanochi Teaching Hospital chapter of the association and its related action. We have also considered the recent ruling of an Accra-based High Court and the goodwill we have received from the Parliament Select Committee on Health and the Ministry of Health to help resolve all the issues that caused the industrial action. We therefore wish to appeal to our members of the CAT chapter of the Association of Medical Laboratory Scientists, as well as all the regional chapters who took action in solidarity with CAT, to remain calm and return to work so that NEC will have an opportunity to review all the matters arising out of the occurrence for further decision to be taken going further. NEC would like to assure all members that their matter remains legitimate and will continue to pursue it for proper and effective redress at the national level. Thank you very much. So effective today, the strike has been called off. Well, you are here with us, and then you heard the request from the committee. And as we said, as a result of the high respect we have for the committee, the strike has been called off. Oh, certainly, we will certainly advise our members. It is the members who take action. And just as it was presented here, if condition remains as it is, and we will not see much change, we have a lot of trust for the committee. And like they indicated, we do not want to place conditionality to them. But we hope that this time round, unlike the previous time, this time round we'll receive a very favorable response. Thank you very much.
Thank you very much. Meeting is called to order. Ghana Medical Association, please.
So those are still live visuals coming to you from Parliament. What has just happened is that they have addressed some sort of press conference there. That's the association, the Ghana Association of Ghana Association of Medical Laboratory Scientists. They have just issued just done a press conference there announcing a call off or a halt to the strike, to the ongoing strike. Now, these are the things that they're saying. They're saying they've taken note of what happened at the Komfo-Anokye Teaching Hospital, after which it was taken over by the entire association, who stood in solidarity with them. They've taken note of the ruling by the High Court, which is the injunction brought upon them by the National Labour Commission and the Health Committee's gesture in Parliament. They're saying, however, they are appealing to their members to return to work out of respect for Parliament's Committee on Health. They're saying that they are confident that this committee will resolve the concerns that they have raised with them. But if the conditions remain, the conditions that they have listed remain, they are obviously saying that they will be advising their members as to what to do. But they've indicated in no uncertain terms the level of optimism that they have for this committee. The health minister has been there. It's unclear whether or not he will be speaking, but you heard Kobnamita Akando, who is the ranking member, NDC member of Parliament. Another NDC member of Parliament also spoke and asked them to call off the strike. It remains to be seen whether or not the members will comply with what their leaders are saying at this particular press conference, essentially calling off the strike. And how soon they will get the responses to the concerns that they have raised with the Health Committee in Parliament. Now, what do you think of this development right now? If you are a patient or you've gone to the hospital recently, you know that this is a big deal. Now you can go back and you have the lab scientists attend to you if they comply with their leaders' admonition to go back to work. I want to hear from you. Send us a WhatsApp message on 0540109009. That's 0540109009. We'll put the number on the screen just in case you don't have it, so you can talk to us what your thoughts are. Looks like a good thing, but with the concerns that they have, will they be addressed as they want? If they don't address them as they want, what it means is that they might just return to their decision not to work. We're trying to get the health minister, Joseph Opoku-Gakpo, our correspondent in Parliament, is trying to get to the health minister to hear him speak on this matter. He hasn't, like I said. We're getting into the second week of this strike. The first week we are, but previously they had warned, they had threatened actually, that these concerns ought to be addressed, without which they were going on strike. Nothing was heard, and then the strike happened. So it'll be good to hear from the minister. But like I said, let's hear from you. So if you're just tuning in, the Association of Medical Laboratory Scientists has called off the strike. It's been almost a week. They started on Monday fully. Monday, Tuesday, Wednesday, 3 days already. Do not call our number. It's been 3 days of the strike, which has been called off today with the intervention of the Parliament Select Committee on Health. You saw them there read out their demands to the committee, and you heard the response from the committee, which is, without any conditions, we want you to call off the strike so that we can look at the matter, and we want you to have confidence in us as a committee, as a parliamentary committee, to deal with your concerns. Response: out of respect for the House of Legislature, we are calling off the strike. But if after we do this, we still don't see any results, or we still don't see a resolution to the concerns that we have raised, we will advise ourselves and our members. This is still The Pulse with me, Gifty Ando, up here, just giving you an update on what is happening so far in Parliament. We also have some other stories that we'll be taking you through right now. We're standing by, hopefully, to get through to the Minister for Health so that he can talk to us. Let's take you back to Parliament right now and see what we've got. president. You've seen Dr. Justice Yangson as well, the general secretary, some other members of the association there. Their turn now to speak to the committee. We can go and hear them now.
For the invitation, and we appreciate it very much. We probably have been wanting to meet Honorable Chair and your colleagues, but time has not been on our side. I'll go ahead, I'll say that we'll bring you greetings from all the doctors and dentists in this country, and they are all looking up to you. I'll go ahead with the introduction. I am Dr. Frank Ankobia, President of Ghana Medical Association. To my far right is Dr. Yao Osafo, a chemical pathologist, one of the consultant chemical pathologists, one of the people who people are seeking to make him unemployed. The next to him is Dr. Amabene, consultant hematologist. Her job is also on the line.
President, we want to hear their voice. We want to feel their voice.
So they should.
Yes, allow them to introduce themselves.
Okay, then if you can, please go ahead and introduce yourself.
Thank you, Honorable Chair. My name is Dr. Yao Osafo. I'm a chemical pathologist.
Thank you, Mr. Chair. My name is Dr. Amabene Akwesikuma. I'm a consultant hematologist.
Respectfully, Chair, my name is Simon Navuru, a consultant pathologist.
Honorable Chair, my name is Dr. Marion Okun-Owusu. I'm the National Treasurer for the Ghana Medical Association. Thank you.
Honorable Chair, my name is Dr. Richard Selome. I'm the Executive Member Male for National Rep.
Okay, I thought you were female. Honorable Chair, my name is Dr. Frank Srebo. I am the Vice President of the Ghana Medical Association. You happen to be my MP, because I come from Efidiase.
Honorable Chair, my name is Justice Yangson. I'm the General Secretary of the Ghana Medical Association.
Honorable Chair, my name is Dr. Titus Bayo, Assistant General Secretary, Ghana Medical Association.
Okay, thank you very much, and you are welcome to
Thank you.
the Health Committee. Rankin.
Thank you, Mr. Chairman. I know you were all here when we made our introductory remarks. We don't intend repeating them. We don't want to hear direct rebuttals to the earlier submissions because they don't have the opportunity to ask you questions. And so we expect that you do your presentation, as dispassionate as possible. Thank you.
Thank you, Honorable Chair. My General Secretary, Justice Yangson, will lead us with the presentation of the petition. Honorable Chair, I must say that before he starts, we didn't think, in fact, that we were a party to this. But you calling us alone, we needed to honor it, be as it may. That because we felt that we had not issued anything as to strike or something. But thank you very much for. Thank you very much.
Hello, hold on, President. President, you issued a statement in Koforia on Sunday, did you?
Yes, Honorable Chair.
So it makes you a party to the issue.
That's right.
No. So obviously you're a party to it. So we are listening to you before we go to Confanochi to also make their position on the issue. So please go ahead.
Honorable Chair, you are right, perfectly right. We thought we were not on strike. Our profession was under threat. That's why we issued that statement. But be as it may, I'll let my General Secretary make a presentation. Thank you.
Honorable Chair and committee members, thank you very much for this opportunity. We would like to touch on several aspects of this issue that is before us. We think that we need to present a holistic. We think that we need to give you optimal information that will guide you in your work. In the process, we may provide some information that maybe others may see them as reactions to what our colleagues may have said. But for us, that is our presentation of what ought to be. Thank you very much. So we'll begin with some historical perspective of background of medicine itself and laboratory medicine as a specialty. We believe that holistic health delivery requires a multidisciplinary team that will comprise of medical doctors or medicine, surgery, laboratory and diagnostics, pharmacy, public health, nursing. With advances in medical knowledge, there has been a diversification that has come to play, and this has resulted in many subspecialties, all with the aim of ensuring that the patient has comprehensive care.
Those are still live visuals coming to you from Parliament. Dr. Justice Yangson, the General Secretary of the Ghana Medical Association. As you know, the Ghana Medical Association has issued their own statement on this matter, and so they are also there to present their case. As it's going through the history, let's take a quick break. We'll go back to Parliament shortly. For now, do stay with us. We'll be right back. Report. I want to take you back to Parliament right now, where the Ghana Medical Association is also speaking, making its points. Let's go there right now.
Death, murder, and harm, harassment, and assault directed at laboratory physicians, residents, and specialists should cease forthwith. The GMA takes a very serious view of this otherwise criminal activity at the workplace that are directed towards our members by the medical laboratory scientists. The Ministry of Health and the various hospital management should also ensure the straight prosecution of the perpetrators of these crimes. The GMA calls for a broader stakeholder consultation to look at the draft national laboratory policy. Mr. Chairman, basically, these are the main crux of our demands. The last bit we want to highlight on is that a certain impression was created that the attempt to get clinical hematologists at Komfo-Anokye Teaching Hospital is one that has been orchestrated by the Ghana Medical Association, probably in cahoots with the Ghana College of Physicians and Surgeons. What it is that the Ghana College of Physicians and Surgeons has been established to train specialist medical doctors who are members of the Ghana Medical Association. The countries need specialist care. It is the position that Komfo-Anokye Teaching Hospital at some point wanted to be a teaching site, for which reason the Ghana College of Physicians and Surgeons have to do accreditation. And we as GMA, we are very happy with that because it gives our members another space within which to train beyond Korle Bu. And as part of that exercise, it came to light that as a very high-level training institution, the Ghana College of Physicians and Surgeons will need a certain basic minimum of expert consultants to train people who want to be specialists. For which reason, a requirement or a checklist, including the need for clinical hematologists, was given out. That is not to say that that checklist means that clinical hematologists will be trained to take over from medical laboratory scientists. We believe that we work together. But for the progress of our profession, laboratory medicine should never, never be curtailed by any other group of persons, and they should be allowed to practice. Thank you, Mr. Chairman.
Thank you very much, GMA, for your submission. And if we got it clear here, among others, you are seeking that headship should be a function of management. The lab space has all kind of personnel, and for that matter, it should not be a preserve of the biomedical scientists. The lab physicians must be restored to practice immediately. Residents should be granted access to labs for training. There are threats to physicians in the labs, and you think this should stop. You raise issues about HEFRA, so HEFRA will talk to it. And you raise issues of accreditation processes by the Ghana College of Physicians and Surgeons. They will also speak to it. Are we in sync? You discounted the national policy. You called it draft.
Yes.
Okay. Once you are assured about these positions, we are happy about your presentation. And we'll say a thank you to this. Thank you very much. So, do you want to ask a question?
No. Still clarifications. I hope, just as has been directed by Mr. Chairman, that all documents you have referred to will be presented to the committee. And we have listened, and we are going to continue to listen to all parties. We'll have time to deliberate on issues. But there are issues that we will not pretend to be superintending over them. Issues of murder, issues of criminalities, those issues, I think that irrespective of how unhappy somebody is, there are laws in this country that are clear. So please, when you mentioned those ones, I was taken aback. So as for those ones, we don't have jurisdictions over criminal issues and yes, so those ones, don't assume that the committee is going to determine who has caused murder or who has caused, any criminal activity. So I think that you have made your point, we've heard you, and we'll take it from there.
Respectfully, we appreciate your position.
Yeah, hello.
It is not the view of the GMA that your committee should be the one prosecuting. But what we said was that we are calling on the Ministry of Health and the management of these hospitals where these incidents have happened and also been reported to the Ghana police, and then subsequently some investigations have been conducted to ensure that finality is brought to these issues by way of prosecution. Thank you, sir. Off your mic.
Mr. Chairman, I wish also to appeal to GMA that henceforth they should also control their interviews and reactions in the media space with the greatest deal of respect. We've heard every party, and we need amicable resolution to resolve this particular matter. So let us all restrict our reactions. Thank you.
Thank you, Honorable Deputy Chair. We've taken note of that. But I would want to reiterate here that GMA...
He's a ranking member.
Honorable ranking member.
You want to take Dr. Bachiya, the MP for Obuasi.
He's a deputy.
Yes, Obuasi MP. Obuasi is there.
Sorry.
Yeah,
sorry.
He's
deputy chair.
The deputy chair.
Oh, sorry. Honorable ranking member, we appreciate your concern. What I can assure you is that GMA never started any of these. If you are telling us, we have always been civil. You know how doctors are. We've always been civil. We've always been civil. You understand? So we are not the violent type. We did not even want to go on air, but we were actually prompted to do that. But if you've advised us, it shouldn't be to only GMA. It should go to both sides. Because we cannot sit there and let them always run amok on the radio stations with misinformation, and we don't react. So please, we thank you very much for your advice.
All right. Thank you, President. So the ranking has advised, and I'm happy the GMA will take it accordingly. We also advise members of the Medical Laboratory Sciences Group so that after here, we all be guided and guarded by whatever we pronounce out there. We should just stay calm and then leave it to the committee to look into this issue. So thank you very much, GMA, for the fantastic presentation.
And those are still live visuals coming to you from Parliament. The Select Committee on Health has been meeting with the GMA. They earlier met with the striking lab scientists who have called off the strike subsequently. Dr. Nana Ayew is the is the chairman of that committee there. You just heard him speak, recapping the concerns that the GMA has. Some of you have been sending in your messages before we go. This one says, we are so glad that the medical laboratory scientists have called off the strike. Please, Parliament Select Committee on Health should kindly deal with their concerns. This is Prince Granting sending that one in. And this one says, I am glad for the call off for the strike from our colleagues in the Medical Lab Association. Nonetheless, we pray that this alleged attempt of bullying all health workers by medical doctors will end. Echo sends that message. My final message, and I have a lot, I beg your pardon, these are all that I can take, says great news from the medical laboratory technicians for calling off the strike. The matter should be well looked at because within the health sector, we work hand in hand to give the best of care to the public. From Baba Lukman. Thank you so much for your messages. Everybody seems happy. Hopefully, you're calling on hopefully this will be done. Your calls on the Parliamentary Select Committee to do their work. And that's it for this hour.